Hi everyone. Thanks for joining us. We're just going to give it a couple of minutes just so everyone can join, and then we'll kick off in a minute or two. Okay, so I think we can kick off anyway. So hi everyone, and welcome to tonight's webinar, and thank you all for joining. My name is Katie, and I'm on the team here at SIMS. And tonight I'm joined by Clara McKeown, who is our nurse manager at our Swords clinic. So I'll just give you a very brief intro to SIMS before I hand you over to Clara. And if you have any questions throughout the webinar, please pop them into the Q&A box, and we have a time at the end to answer questions. So we have 6 clinics in Ireland. We have 3 main clinics located in Clonskee, Swords and Cork, and we have 3 satellite clinics located in Dundalk, Carlow and Limerick. SIMS is also part of the Virtus Health family, which is one of the world's leading fertility groups. So we share experience and knowledge from around the world, and this ensures that our patients get access to the very best of care. At SIMS, we also have a range of options. So we do everything from fertility testing to IVF to ICSI. We have sperm donor programs, and we have egg donation programs and genetic testing such as PGTA. So with that, I'll hand you over to Clara, and she'll take you through tonight's webinar, which is going to explore the role of fertility testing, treatment, the nurse's role, and navigating what to expect when starting fertility treatment.
Thank you, Katie, and thank you for introducing me. As Katie said, my name is Clara. I'm the nurse manager at SIMS IVF Swords. I do have to apologise. You can't see my face this evening. My camera is just having issues, and I even put on makeup and everything for this evening, so my apologies. But the most important thing is the presentation. And today, as Katie said, I'm here to talk to you today just a little bit about navigating fertility, what to expect for any new patient coming through to SIMS Clinic, and what us as nurses can do to help you throughout the process. So just to go through a little bit about that. So just a little overview. I'm going to discuss about the patient pathway, and what that means is really from when a person decides they want to seek fertility treatment, what's the first step that they will take. A little bit, as I said, about the role of the nurse. I'm going to touch on the causes of infertility. Then we're going to touch on investigations. We're going to look at treatments. I'm going to focus particularly on IVF and ICSI cycles. But of course, if you have any questions, as Katie said at the very end of this presentation, please do type them into the message box, and I'll do my very best to answer them. I'll touch on a little bit about medications and, of course, the impact going through fertility treatment has on patients and on couples. So just about the patient pathway, it takes a lot of courage for a person to make that decision to say that I need help or I want to seek fertility treatment. We at SIMS Clinic, we do try to make it as easy as possible for you. We always direct our patients to our website, which you'll see in the slide. It's www.sims.ie. It's a very user-friendly website and very easy to navigate. And it's on that website that we ask that you complete a new patient form. It's on that new patient form that we ask for very basic details. And if you have any test results or any medical notes to submit them in as well in advance of your initial consultation. Usually within a few days, and really no longer than a week from submitting your patient information, your patient form, one of our patient coordinators will be in contact with you, normally by phone or sometimes by email, to arrange initial consultation with one of our fertility consultants. As I mentioned, it's always kind of worth, if you do have any test results or relevant referrals or medical notes, to have these to hand for this fertility consultant at your initial consultation. So really what that means is that you're making the most of the time that you have with this doctor. This consultation, it can be arranged either in person, face-to-face, by phone, or by Zoom. So that's really your personal preference. Once you've had that consultation with the doctor, you'll receive a phone call from one of our nursing team. And with that phone call, it's designed to provide you with additional information on the clinic, including the drug payment scheme card, pharmacy information, and really just to summarize the conversation that you'll have had with your doctor. Your fertility consultant who you had the initial consultation with may advise you to have some investigations or some tests, and I will touch on this later on in my presentation as well. We do all of our investigations and tests in-house, certainly in our main clinics in Swords, in Clonskea and in Cork, and we do also our blood tests in our satellite clinics as well. So they can be arranged all within the one building. Once you've had your investigations and your tests completed, we'll arrange a doctor return consultation with you. So it's at this consultation that this consultant will discuss the results of the investigations performed and will generate a treatment plan for you based on you or your partner's history and your results as well. Really a treatment plan, it can include anything or can vary anything from what's called a TSI cycle, which stands for time sexual intercourse, or it can go right up to IVF, ICSI cycle, or anything, or even egg donation as well. And as I said in my overview, I will elaborate a little bit more on treatment cycles as well later on in this presentation. Once you've had that conversation with the doctor, you'll receive another phone call from one of the nursing team. As the nature of this phone call, it's called a scheduling call. So it's really to kind of, again, to answer any questions that you might have after the consultation with the doctor, to discuss the treatment cycle in a little bit more detail by assigning dates and elaborating a little bit more on medications and timings and things like that. You'll find the nurse might kind of ask you questions like, oh, do you have any weddings or any events or holidays kind of coming up? And the reason for that is just to kind of take these things into account, because we don't want your IVF cycle to clash with times that you might be away. So we can kind of work around that and plan around that. We tend to kind of call, once you have that return consultation with the doctor, you'd normally receive a phone call from one of the nursing team within about 1 week. And the reason for that is just to kind of keep the momentum going, keep things kind of fresh in your head and answer any questions that you might have. I do want to say that there is no pressure that you have to proceed with treatment with us here at Sims Clinic. And sometimes just having that consultation with the doctor is enough to give that information to make a decision later on. But just to kind of know, as the nursing team, we are here to help you, to advise you, and to support you as well. A little bit about the role of the nurse. So the nursing team comprises of nurses, a lovely team of nurses, midwives, and healthcare assistants. We work in various departments, and we work alongside our multidisciplinary team with our patient coordinators, our medical team, and our embryologists as well. We communicate with everyone regularly. We're a nice kind of small unit, and we know everyone really, really well. We work really well together as well. We work in various departments. You'll find our ultrasound scans department is predominantly run by the nursing team, and our nurses have received specific training and qualifications in fertility scanning specifically as well. We also have a theatre and recovery department, and it's here where we perform procedures such as IUIs, egg collections, embryo transfers, and any other procedure that really requires sedation as well. We would have our 2 healthcare assistants predominantly in theatre, in addition to maybe 1 to 2 nurses, and of course a fertility consultant as well. We do bloods Monday to Friday, so you'll remember I mentioned about investigations and tests that we do. A lot of those investigations will comprise of blood tests, so we have great flexibility in times that we can do the blood tests for you, and we usually have a very quick turnaround with the results as well. So normally we would have a healthcare assistant who manages the blood room, and will take really good care of you for those appointments. We have a nursing team that schedules treatment cycles. So as I said, after your return consultation, you'll always hear from one of the nursing team who'll get in touch to schedule and to plan your treatment cycle. And that treatment cycle is very individualized from person to person. Medication education is a really important part of what we do here in the nursing team. We're very aware that many people will not have ever taken injections before. So we kind of give you information step by step in a way so as not to overwhelm you at any one time. But we provide injection demos, we give you videos and a nice kind of schedule as well for you. We have an egg donation program here at Sims Clinic as well, where we're affiliated with two clinics in Manchester and Portugal. So we have a very efficiently run egg donation program within Sims Clinic, and we have a number of nurses who work on that program as well, who are more than happy to provide all of the information and to support and guide you through that egg donation program if that is something that has been devised for you. Salve and phones. Salve will be a new word for many of you who are not a patient here with us yet. Salve, it's an excellent patient portal and communication app that we have available specifically for our patients at Sims Clinic. It can be very beneficial for our patients. It's very, very user-friendly for our patients to contact the nursing team, contact patient coordinators or embryology with any queries that you might have. It also prompts for medication reminders and appointment times as well. In addition to Salve, the nursing team, we operate a telephone nurse line for additional support and advice. And both Salve and our phone lines, they're operated Monday to Friday from 8 to 4 and on Saturday mornings as well. And in addition to that, we also have an out of hours phone for any patients in emergency situation where they're very worried or have any concerns out of those normal Monday to Friday hours. We have that emergency phone available to you. And ultimately, we are here to support you, the nursing team. That's our fundamental goal, to make this journey for you as smooth as possible, really from start to finish. We know and we appreciate that many women and couples, you can really be at your most vulnerable, and it can be very, very overwhelming and very foreign for many of you, especially because it's so new and it is so foreign. So we're here to kind of make things really smooth, really clear. If as nurses that we can't answer your questions, we'll absolutely go to your consultant and ask them for the answers if they have it. And if needed, make an appointment for you at an earlier stage than what was planned. We're here just to say we're here to advocate for you on your behalf as well, and really just kind of help you along the way as best as we can. I just want to touch then a little bit about the infertility causes. So what's quite interesting is that 25% of the causes of infertility are unexplained. And many of you might be like, okay, yeah, you do your investigations and all of the results come back normal. And although that sounds great in theory, you know that everything is coming back as it should, it can also be really frustrating for many people, because although all the results are coming back as normal, this is more so for kind of heterosexual couples. It doesn't really answer the question that, like, okay, well, we've been trying to conceive for so long now, and why is it not working? So it is kind of an interesting kind of statistic that 25% of cases of infertility are unexplained. In addition to that, you'll see in the pie chart, 30% are contributed to female causes, another 30% are contributed to male causes, 10% are combined, and 5% are other reasons again. I quite like this slide. I love simplifying things and making things really, really easy to understand. And when you break it down, it is actually quite simple. When you consider kind of what are the factors that lead to a pregnancy, there's 3 factors. There's the egg, and broken down, we look at supply and quality. There are investigations that look at ovarian reserve or egg supply, and I'll touch on that now in the next couple of slides. Quality, not so much, but that can be kind of looked at as an egg develops into an embryo, a pregnancy, and then a live birth as well. Another factor that leads to a pregnancy is sperm, of course. So with that, there is an investigation called the semen analysis that looks at the count, motility, and morphology. And lastly, the environment. And when we talk about the environment, we're talking about the uterus itself, the womb. We're looking at the lining of the womb and the fallopian tubes. Are there any reasons why an embryo can't implant into the lining of the womb? Maybe there's a polyp or a fibroid, or is there a blockage in the fallopian tubes? Is there anything kind of structural or anatomical wrong with the environment that can be fixed or picked up on? And this is what I'm going to kind of touch on in the next few slides. So just to talk about investigations. So the first is the male investigations. As I mentioned there, the very main and the most common and frequently requested investigation for men is semen analysis. Now, very first the first to say I'm no embryologist, I'm a nurse, but we do have an amazing team of embryologists who work within SIMS clinics. They're highly experienced and highly knowledgeable. In terms of semen analysis, I'm breaking it down, but when they're looking at a semen analysis, they look for the number of sperm in the sample. They look at the motility of the sperm. So this is all done under a microscope to check that the sperm themselves are moving. And lastly, they look at the morphology as well. And what I mean by morphology is that they're looking at how they look under a microscope. Do they have a head and do they have a tail? And are they moving? And they're obviously counting the numbers as well. As I said, I'm very basic. I put an embryologist to shame in my explanations here today, but hopefully it's kind of enough to give you a little bit of an explanation and a little bit of understanding of what we do here at SIMS Clinic. For the women, there's a little bit more testing to be done, and that testing comes in the form of blood tests, and I'm going to elaborate a little bit more on that in my next couple of slides. An AFC stands for antral follicle count. You'll remember in my previous slide, we spoke about egg number and egg supply and egg quality. An antral follicle count gives us a good idea of the number of eggs that a woman might get in a treatment cycle. It's done by ultrasound scan, and predominantly all of our scans done at SIMS Clinic, they're all internal scans or vaginal scans. And the reason for that is that it gives us a very clear image of the lining of a woman's womb and of the ovaries as well. And when we're looking at the ovaries, we're counting these little kind of very small follicles. They're like little dormant circles in black. And that's what we are counting to give us a good idea of how a woman might respond in an IVF or any real treatment cycle. Anatomical testing. So we spoke about the environment. Are there any reasons why a woman's not getting pregnant in terms of is there any issues with implantation or any issues with ovulation, for example? So there are procedures that we do here in the clinic called an SIS and hycosis, which I'll touch on again in another couple of slides. And of course, there's always other investigations that are specific to certain individuals, and they will be very much individualized for that person from the doctor given after a review of that person's history. If you're kind of anyway familiar with fertility, you might have heard this word AMH mentioned before. It comes up every year, like Fertility Awareness Week, or it'd be the first blood test that we would request from a woman coming through to SIMS Clinic and most other fertility clinics, I would expect as well. AMH, it stands for anti-Mullerian hormone, and it's a protein that's secreted by the ovaries. This blood result, together with an antral follicle count scan, will give us a very good idea of what a woman's ovarian reserve is like. And with that information, the doctor can generate a really good treatment plan individualized to that person. In AMH, just to say, it gives it gives us an indication of the number of potential eggs a woman might get, but it doesn't address the quality of the egg itself. And as I mentioned, there is no real test that can test the quality. But even just to have that information about your egg reserve, that's crucial information. A woman's AMH will vary. I get asked this question, like, well, what's a normal AMH? And it really varies on a woman's age, to be totally honest. The younger a woman is, the higher you'd expect the AMH to be. And as the woman gets older, the AMH also declines. So you'll see in this graph here, in orange is considered your normal ovarian reserve. In green would be more probable of polycystic ovarian syndrome, and in red would be that lower or diminished ovarian reserve as well. So that's just a little bit about AMH and antral follicle count and what we can do with that information. In addition to the AMH, the other blood tests that are generally requested when you come through SIMS Clinic, particularly for embryo development. And what we like to look at your thyroid function. So we just want to see like a baseline that your thyroid stimulating hormone is within a normal level. We look at your full blood count, and really what we're looking at your iron, your platelets, your red cells, your white cells. So we just want a kind of general blood profile to make sure you're well and you're healthy in advance of going through, in particular, an IVF cycle. Many doctors would request day 2 to day 5 hormone bloods. So these are bloods that are taken specifically at this part of your cycle for the reason that it's very difficult to interpret at other parts of your cycle. So if they're taken at between day 2 and day 5, there's a very clear reference range to compare that result to know is it normal or abnormal. Another blood test that's often requested by the doctors is testosterone, which is a funny one because you think like, oh, that's a male hormone, but actually as women, we all have a little bit of testosterone, and we need testosterone in our body to help with follicular recruitment as well. Another blood test you probably will have all heard is rubella, which is the medical term for German measles. As children in Ireland and most of the EU, I expect certainly, we received the MMR, which is the measles, mumps, rubella vaccination as children in primary school. So most of us, just with that vaccine alone, were rubella immune. There's always a small portion of people who either lose their immunity or who are never immune, and with that we would always recommend just to have a booster, because from a preconceptual point of view it's really important to be rubella immune. EU bloods, it won't be something that's familiar to you if you've never been through Sims clinic or a fertility clinic before. EU bloods, it's the term we use for a viral screen that checks for a range of infectious diseases. It's a legal requirement and it's part of our legislation. I put it up on this slide just so if you do eventually become a patient with us at Sims Clinic, it's not a big surprise. Like, oh, I never heard of EU bloods before. And again, of course, there may always be further investigations required for that individual person. I've listed quite a few bloods here. They're not relevant for everyone. So one person might only ever need an AMH and rubella, and other doctors might request a little bit more as well. But as you can see, there is quite a variety of blood tests that we like to look at Sims Clinic. Again, kind of just touching on keeping in the theme of investigations, and I had mentioned previously that we like to do investigations just to see is there anything anatomically interfering with the lining of the womb or any blockages in the fallopian tubes. We do procedures within the clinic called an SIS or HICOSI. SIS, it stands for saline infusion sonography, and it examines the uterine cavity itself. So just to assess any presence of abnormalities such as fibroids or polyps. In addition, with the HICOSI in the image underneath, it examines the fallopian tube, the patency of the fallopian tubes as well. It's a procedure, it's done in the clinic, as I said. It's normally done between day 4 and day 10 of your cycle, so essentially after your period but before you ovulate. Most patients tolerate it perfectly fine. What it is it's performed by a senior nurse or stenographer or one of our doctors, where the doctor will insert a speculum into the vagina, will pass a very small, soft catheter in through the cervix. The doctor or stenographer will then take the speculum out and insert the transvaginal scan probe, and with that will inject a saline solution in through the catheter. And you'll see in my first image there on top that there's quite a black area there in the cavity of the womb. And with that it helps to expand the lining of the womb, and it enables us to capture any polyps or fibroids that might be there. And similarly with the fallopian tubes as well, it's only on the HICOSI that we're actually able to see the fallopian tubes to see if there's any blockages or that. Moving on then, it's a little bit about treatment. I said earlier that I'm going to kind of focus mostly on the kind of IVF cycle. I'm going to touch on IUI as well, but if you do have any questions specific to treatment cycles outside of that, please do kind of type them in, and I will always do my best to answer them for you. But treatment, I've kind of mentioned everything that we do here within Sims Clinic, starting with TSI, which is time sexual intercourse cycle, IUI, IVF, ICSI, and PGT, which is genetic testing of the embryo. We do egg freezing, egg donation, we have donor sperm, and shared motherhood as well here at Sims Clinic. I put this table up again, keeping with the theme of keeping all things simple and clear. I really like it. It's really, really basic. But if you actually look at this table or this kind of diagram, step 1 of going through any sort of IVF cycle is egg production stimulated by hormone therapy. So step 1 is simply to take injections to stimulate your ovaries to grow eggs. Step 2 then is an egg collection. So your eggs are retrieved from the ovary. Step 3 is a sperm sample is provided. Step 4 is the egg and sperm are combined to allow for fertilization to happen. And step 5 is the fertilized eggs, or in our case, embryos called a blastocyst, are introduced back into the uterus. So again, it's a very basic, very broken down diagram of what happens step by step in an IVF cycle. If only it was that simple, but it is still nice to have an overview of that. Just to talk about the different types of medications, this tends to overwhelm patients, and even just from the get-go, just the idea of taking injections and how they're going to do it, how they're going to store it, how they're going to hide it if you're living with your parents and things like that, you know. So it does kind of cause a lot of anxiety just from the very onset and from the very beginning. So what I say is, if there's anything we can do as nurses to kind of relieve that anxiety, drop us a message themselves, give us a phone call. Our pharmacies that we're affiliated with are just fantastic. So they will do their very best to help you and to explain things to you as you go through your journey, your fertility treatment cycle. Down regulation. It's a phase in some of our IVF cycles, not all cycles, but certain cycles where patients would benefit from a down regulation phase. And what it means is you'll take medications in advance normally of your period to suppress your ovaries and your own natural hormones. Stimulation phase is where this is the main phase. When you hear kind of talking about follicle and egg growth, this is what we mean. When you take injections to stimulate your ovaries to promote follicle growth within the ovaries. These injections, just to say, they're synthetic versions of the hormones that as women we naturally produce, so generally FSH and LH. If you think about it, in a natural cycle outside of IVF, you'd expect a woman to ovulate maybe one egg a month, which is why as women we tend to have mostly singleton pregnancies or maybe twin pregnancies at most. But in IVF, however, instead of just kind of trusting our own body and our own hormones, by taking these injections, they increase the number of follicles and therefore eggs to grow as many eggs as we possibly can get for egg collection. I just want to explain, you'll hear the word also follicle mentioned a lot. So in favor of eggs. And just to explain what a follicle is, I describe a follicle as a shell or a sac that surrounds an egg. So if you can imagine, eggs are microscopic. They can't be seen on ultrasound scan. However, follicles can be seen on ultrasound scan. And science and research shows us that when a follicle reaches a certain size, anything really from 15 millimeters, you'd expect there to be a good quality egg. So we're guided by follicle size on ultrasound scans to determine when to plan for your egg collection and that there should be good quality eggs there. In addition as well to relying on scans, we also take hormone bloods as well, where we look at certain specific hormones, in particular estrogen, that should line up with your ultrasound scans as well. So I just wanted to explain that because I'm very conscious I throw in these words and I don't explain these things. Trigger injection. Trigger injection is fairly applicable to most of our cycles, including egg freezing. Well, obviously all of the down regulation stimulation are also applicable to egg freezing, but the trigger injection is also applicable to IUI and time sexual intercourse cycles as well. And the trigger injection, again, you'll hear the word trigger thrown around quite a bit. It refers to a medication that causes a woman to ovulate. Okay, so it's a very timed injection when we'll give you very clear instructions in advance of an egg collection or an IUI procedure, in terms of exactly what time you need to take it and how you are to take the injection as well. And lastly, pregnancy support. We always prescribe and recommend a hormone called progesterone to help support a pregnancy. I always say you can never have enough progesterone in your body. Some patients do ask, and I was like, "Oh, am I having too much progesterone?" And the answer is no. It's like you can never have enough progesterone. The main injections that we often refer to, as I said, is your stimulation injections. And just to say, like, fertility medications have come a long, long way over the years. A lot of the medications that we use, most of them, I should say, they're really, really user-friendly. They look like EpiPens or diabetic pens. So as daunting as it might seem, once a patient comes in and we have that opportunity and time to educate a patient on medication, they do leave the clinic kind of feeling a little bit more calmer and reassured and kind of have the knowledge to move forward with their cycle. We often get asked about the side effects of medications, and I suppose the important thing to remember is that it's so different for everyone. It really can vary. It can vary on the medications they're taking and how a woman's responding to them physically as well. I've mentioned a few side effects. Really, the most common ones would be tiredness. A woman might find themselves a little bit more emotional than normal. Headaches, and the headaches is kind of particularly in the down regulation phase, and a little bit of nausea as well. So it's just really important just to mind yourself and drink plenty of water. For women who have a greater follicular response, I should have said it here, abdominal bloating is more common as well, particularly towards the latter part of their stimulation cycle. I touched on scans earlier, but just to elaborate, so when a patient comes through for a treatment cycle with us, be it a timed sexual intercourse cycle, IVF cycle, egg freezing cycle, you will have ultrasound scans. This is how we monitor your response to the medications. When we do your scans, we're looking at the lining of your womb and at your ovaries as well to see are the follicles growing and therefore eggs. These scans, they can be done obviously in our main clinics in Clonskea, in Dublin, South Dublin, in Swords, in North County Dublin, and in Cork. And as Katie mentioned at her introduction, we also do them in the satellite clinics as well, in Carlow, Dundalk, and Limerick. So for patients who live kind of a little bit outside or a little bit away from the main clinics, that can be facilitated in our satellite clinics as well. For an IVF cycle, you'd expect to have kind of on average between 3 to 4 scans in about a 2-week period. And for TSI, or which is the timed sexual intercourse, and IUI cycles, you'd expect to have maybe 2 to 3 scans as well. For both IVF, IUI cycles, you'd expect patients to take these injections and to have those scans anything between a period of 10 to 12 days. And as I mentioned, ovarian response and the lining of the womb would be assessed at each of these appointments. We pay particular attention to the follicle measurements to ensure the correct timing for egg collection is planned, or for trigger for an IUI, that the IUI procedure is well planned as well. Most of our patients tolerate the scans very, very well. For these scans, we ask that you have an empty bladder, and we always give our patients the opportunity to go to the toilet as we call them in for their appointment too. There are patients who have a condition called vaginismus, and with that, we just take extra care and extra support. And of course, there are times where women, they just simply can't tolerate the transvaginal scan. So there are always exceptions to that, where we would need to do an abdominal scan for them. Our scans, they're performed Monday to Friday in the morning. And yeah, I think that's everything about scans that I have to mention now. So just to move on to talk about egg collection. Egg collection is specific to IVF or ICSI cycles, or PGT as well. IVF, again, it's like an umbrella term, and it describes really the fertilization process, as does ICSI. And PGT is a little bit more advanced in terms of the genetic testing of the embryo itself. But all of these patients within that treatment cycle would have an egg collection, okay? It's a procedure where they take the eggs from the ovaries. So you'll remember I spoke about the follicles and how we know when a woman is ready for egg collection, because we're measuring the follicles at every scan appointment. And when follicles reach a certain size, we know from that that a woman will be ready for egg collection. And that size is generally 17 millimeters. Approximately 17 millimeters. There's always a little bit of subjectivity as well to that. The egg collections are performed at Sims Clinic. They're performed in the main clinic. So again, in Clonskea, in Swords, North County Dublin, and again in our Cork clinic as well. An egg collection, just to explain, it's a procedure. It's performed under sedation, where the doctor will aspirate the fluid from the follicles. The fluid is then examined under a microscope to assess if there's eggs present within the fluid itself. So you'll find on the day of egg collection, you'll have a doctor present, you'll have a healthcare assistant assisting the doctor, and you'll also have an embryologist in the room doing that job of assessing the fluid under a microscope and counting the eggs. The scan, or the egg collection, I beg your pardon, it's not performed blindly. It's performed under ultrasound guided, and the doctors who do these egg collections are highly experienced. They do it every day of the week, and they're very, very knowledgeable in what they do. An egg collection is performed in the morning time. So again, it's performed Monday to Friday in the morning time. And we do, given that patients have sedation, we do recommend, of course, to take the day off work itself, and also just to take the next day as well, if that's possible, just to give yourself that little bit of time to recover. But the main recovery element is really from the sedation. Most of our patients do recover very, very well. Again, the more follicles a patient has, that little bit more uncomfortable that she'll be, and it could take just a few days for everything just to settle down and the ovaries to shrink back to normal size. Assuming everything kind of is going to plan, and this refers to a patient who decides to have an embryo transfer, or embryos developed and then subsequently an embryo transfer. The embryo transfer would happen 5 days after the egg collection. So you'll find on the day of egg collection, you'll receive an update. You'll receive an update from the nurse or the doctor that day about how many eggs you had collected, and then you get regular updates right up until the point of transfer on your embryo or hopefully embryo's development. There sometimes can be a slight variation to this as well, in terms of the updates. So you should really, in theory, you should get a phone call the next day after the egg collection with the fertilization results, and then 2 days later with the view to book you in for a transfer 5 days after your egg collection. The transfer itself, it's performed in the afternoon. We ask patients to have a full bladder, and there's no sedation required for most of our patients. So with that, given that there's no sedation, really this time off work isn't necessary. Many patients naturally like to take the day off work itself and the day of the transfer, but really there's no medical indication to take any subsequent days off. You're not going to feel any different leaving the clinic as you did when you came into the clinic. But again, it's personal choice. Some patients feel that they just want that little bit of time off, and that's also fine as well. The procedure of an embryo transfer, it's really not too dissimilar to a smear test. Again, the doctor will pass a speculum into the vagina to locate the cervix, and the doctor will then pass a small catheter in through the cervix and insert the embryo into the uterus. Like the egg collection, it's performed under ultrasound guided, but different to that, it's an abdominal ultrasound scan that the healthcare assistant will apply. So you'll be able to actually see yourself that the embryo is being transferred, which is actually a really lovely experience as well. I just want to touch a little bit on IUIs, not to forget about the IUIs. The IUI, it stands for intrauterine insemination. IUIs you find more commonly used for women who opt for donor sperm. It's similar to the treatment cycle itself. It's quite similar to an IVF cycle for the large part, but with a much more reduced dose during the stimulation phase. You'll remember I said for an IVF cycle, the idea in taking those stimulation injections is to have as many follicles and therefore eggs as possible. With an IUI cycle, we don't want as many eggs as possible. We want 1 or a maximum of 2 dominant follicles at the time of ovulation, for the reason being that we're not taking the eggs or the follicles out of the body. They're staying within the body, so we can't control fertilization in that way. But once we're happy that there's 1 or 2 dominant follicles at a maximum, that woman would receive a trigger injection to cause ovulation just in time for her IUI procedure. An IUI procedure is predominantly performed by one of the nurses, and a nurse will, again, insert a speculum into the vagina to locate the cervix, and once visible, will pass a very small soft catheter into the cervix, and with that, a semen sample injected into the womb. The semen sample used for IUI will be prepped in advance by the embryology team to ensure it's of very good quality, and a pregnancy test would occur 2 weeks later. As I said, I just mentioned here in my presentation, the normal times that we do IUIs at the 11 and 11:30. There's no sedation required unless it's truly indicated, and time off work for that reason isn't necessary either. I'm nearly finished because we're going way longer than I thought, so I do apologise. Thanks for kind of keeping your attention here, if you managed to do so. Just to talk about the impact of treatment. My presentation makes it sound probably really simple. Oh, this is such a breeze. No issues whatsoever. And for many patients, it is very straightforward and it is really simple. But naturally, it can have impact. The impact of treatment can affect our mental health, our physical health, emotional well-being. So it's just really important to mind yourself kind of during this time and give yourself kind of that extra bit of time and self-care for you and for your partner if your partner is involved as well. We do have additional support available for our patients. We have an excellent counselling service who specialises in fertility, who's there for you to support you. And I often find counselling isn't for everyone. Not everyone needs counselling, but for patients who do need counselling, it's sometimes a really lovely opportunity to speak to someone that you don't know on a personal level, to have someone to listen to you vent and to give out, and it can feel sometimes like that the world is against you, and it's nice to have that person to listen to you and to give you some practical advice kind of with that as well. We have we have a dietitian as well. She's based in Carlow. Her name is Sophie Pratt. She's an excellent practitioner who's there to help and advise you as well as needed. And the doctor will be more than happy to send a referral if required. Acupuncture, it kind of comes up every so often. A lot of patients find acupuncture very beneficial. It can help patients feel more relaxed. It can help patients to regulate their cycle that bit more as well, particularly for patients who have irregular cycles or maybe polycystic ovarian syndrome. So it's very much an individual choice for that person. As I mentioned, it's so important. And I know you hear these buzzwords of self-care and all of that, but when you're going through a treatment cycle, it does have an emotional impact, even just kind of taking the hormones on their own. You know, it is really, really important to look after yourself. And if you have a partner, to look after your partner as well and do nice things together, go out for walks, carry on with your life. It's very easy to kind of put everything on hold, but I recommend just kind of carry on with your life as normal with a few modifications here and there, which we'll advise you of. And that is everything. So thank you so much for listening to the presentation. And if you've any questions, I will, of course, do my very best to answer.
Thanks so much, Clara. That was great. It was really, really informative going through like all the steps and kind of what to expect at each stage. That was great. Thanks so much.
Thank you.
Well, we'll just give it a minute, and if anyone has any questions about anything in the presentation that Clara's gone through, you can pop them into the Q&A box and we can answer them. And if anyone has any questions that they'd prefer not to discuss on the webinar, you can also email it into communications@sims.ie and we can pass it on as well. So there's one question in there, Clara. So someone has asked, how often will they need to come in for checkups and monitoring and scanning throughout a cycle?
So it's a really, really good question. So if a patient decides to go ahead with an IVF cycle, once that treatment plan is arranged and it's all planned, you'd expect that person to have 3 to 4 scans from start to finish. And those scans would happen really within probably like a 2-week window. After those 3 to 4 scans, that person would have an egg collection, okay? And then all going to plan would have a transfer 5 days later. So really from start to finish, from when a woman starts an IVF cycle, from when she takes her first injection to when she has an embryo transferred back, you're looking at a 3-week period with that 3 to 4 scans in the first 2 weeks, an egg collection appointment, and then lastly, an embryo transfer appointment. The scans themselves, we run a really efficient, I like to think we run a really efficient service that where we give patients a 30-minute appointment, and for the most part, they really do run on time. We open up the scan department as early as 7 o'clock in the morning. So they're obviously really popular appointments, but we can book patient scans in advance. So to accommodate and be a little bit flexible to people working and for childcare and things like that as well.
Yeah, no, that is great. And I think as well, just having that bit of flexibility, as you said, opening from 7 a.m, it makes such a big difference like that for people maybe that don't want to take time off work, or, you know, they have other things to do as well. So that is great.
Yeah.
So there's also another question someone has asked. They said they've heard about prolactin and how does that affect their fertility?
Yeah, that's a really, really good question. We don't routinely test prolactin as much anymore unless it's actually indicated. Previously, it would have been on my slideshow before. Prolactin, if a woman is not ovulating or does not get regular periods, it will be indicated to check her prolactin level. For the reason that if a prolactin level is high, it can interfere with ovulation, and there can be medication and further investigations for women with high prolactin. It's when a woman tells us that she has regular periods, we would assume from that she ovulates, so therefore it wouldn't be a routine blood test that we would check. But certainly for women who don't have regular cycles, it would be a good blood test to have checked.
Perfect. Let me just have another check. Yeah, so someone has just asked as well about the public funding, and that if they have the referral from the GP, what happens next? Would you be able to talk through the public funding pathway?
Oh, I'm really, really sorry. I don't have all of the information to hand, to be quite honest. It's still very new. I know it's kind of gone live from this week, but I really wouldn't be in a position to kind of give any more information at this point. But Katie, if you'd like to kind of take that person's details, and I can get that information, that correct information, and provide that information to that person later in the week, if that's okay. So I do apologise, I don't have all that information at this time.
Perfect, thanks. I'll have another look through the questions here. So we just have a question in here is, do you feel that there's benefit to taking time off after having a transfer? Does it affect your chances, if you're kind of maybe working in a very stressful job, or you have a lot going on? Is it beneficial to take time off after the transfer?
It's such a good question, and I get asked this quite a lot.
Yeah.
If you're to kind of look through the research papers, these randomized controlled trials, and 50% of people took time off work and the other 50% didn't take time off. There's no real difference in the results at all. So from a scientific point of view, there's no advantage of taking time off work. That said, I suppose, I don't know, for me, you have to live life with no regrets. You're putting so much into this treatment cycle, emotionally, physically, financially. If you feel yourself that taking time off work after having an embryo transfer is the right thing for you to do, then I would recommend that that's what you should do. If you're kind of on the fence, you're like, oh no, I'm fine. Some people feel better like just keeping busy and keeping occupied, and then they're better suited just to go into work and kind of carrying on with life. So I'm sorry now, I know some people just want like a really direct answer, and I can't give that to them, but you just have to do what's right for you, and deep down you know what the answer is, whether it is to take time off work or not.
Yeah, no, I think it is. It's so personal, and everyone is so different. You kind of know as well, as you said, like yourself, what you'll feel better doing as well. Definitely. So, and we've just another question in here, Clara. So for someone going through egg freezing, is it the same process going through egg freezing like going through IVF until you get to the insemination part?
Yeah, excellent question again. So yes, exactly. So I know I kind of largely spoke about IVF, but what I would say is egg freezing, it's the very same, with the exception that we don't fertilize the eggs and you don't have an embryo transferred. So going back to that first question that was asked about kind of the time period and the appointment, with an egg freezing cycle similar to that, you'd have your first scan around day 2 of a woman's period. You'd start injection. You'll be advised to start injections, and you'll be on injections for 10 to 12 days approximately. And it's during that time you'll have 3 to 4 scan appointments with an egg collection around the 2-week mark as well. So it's a period of 2 weeks in total, and in that 2 weeks for an egg freezing cycle, they'd have 3 to 4 scans and an egg collection to follow. And similar to that with egg freezing, the idea is you take those stimulation injections to grow as many follicles and therefore eggs as possible, with a view that at egg collection we're getting as many eggs as possible to store in our lab for you.
Yeah, no, I think that's really good as well, just to point out, because I think sometimes with egg freezing, people might think, like even I initially thought when I very first started working here, that you could just go in and you could just kind of go in and do egg freezing, and not everyone is fully aware that you have to do, as you said, the stimulation, and there's still scans, and it's, as you said, essentially like doing a round of IVF without doing a transfer and the fertilization. So I think it is really important as well.
Yeah, no, it's pretty much the very same, with the exception of the embryo transfer. So with the view that we don't just want one egg, we want as many eggs as we possibly can for that person to have for future use if they require it at a later date.
Yeah, well, that's great, Clara. Thanks so much. Just give it another minute or two and just see if there's any other questions that anyone has. With that as well, we are doing half price consults as well for everyone on the webinar. So if there's anyone interested, if they want to talk to a doctor about anything that Clara has talked about today, or they just have questions, or they just want some advice, or they don't know where to start, we're offering the half price consult. So I've popped the code into the chat. You can just use the code nurse webinar on the new patient form that I've also popped into the chat. If anyone wants to discuss anything with a doctor as well, that option is available to them. We'll just have another quick look through the questions, Clara, and then if there's no more questions for now, yeah, so I don't think there's any more questions at the moment there, Clara, so we can leave it at that. So thank you so much for doing the webinar. It was really informative and it was great to go through, all those touch points and explaining what happens at every stage. So thank you very much.
Thank you, Casey. Thanks so much for hosting as well.
Thank you. And thank you everyone for joining us. I'll see you next time.
Yeah, thanks.
Thank you.